Now this topic is very much famous topic in nowadays for social media. So our next speaker, Dr. Sunil Gowda sir, he is practicing psychiatrist and sexual medicine practitioner in Pune since last 15 years. He is a founder and the director of Healing Minds Neuropsychiatry Center and Sanjeevan Sex and Relationship Clinic, Pune. He is the honorary secretary of Society of Mental Health Awareness, Research Training and Teaching, that is a SMART. He is a speaker at many state and national level conferences. Yes, you can continue, sir.
Thank you, Sanjay sir. Good morning, everyone. First of all, thank you very much, organizing committee, for giving me this topic, sexuality in digital landscape and social media, which I consider as a theme of this 14th Sexcon conference. So, to understand the topic sexuality in the digital landscape and social media, we need to understand first what it exactly means. The two things, nowadays we are in internet era. So sexuality in pre-internet era and sexuality in internet era, that is the difference. And what internet or a social media is affecting our thinking, expression of sexuality, understanding of sexuality, information about the sexuality, and its effect. So today I am going to talk about only two things. Basically, I am going to talk about here psychiatrist perspective as well as a sexual medicine's perspective, how it is affecting our sexual health as well as a mental health. So the digital landscape has drastically reshaped how people engage with and understand sexuality. Social media, virtual spaces and online communities offer new way to explore identity, intimacy and relationship. So this shift presents opportunities but also have a significant mental health as well as a sexual health challenges. So I am here to explore the psychiatrist role and sexual medicine practitioner roles in addressing the challenges. So sexuality and information access. Basically, what internet has given to us, it's a lot of information, right? So definitely advantage is nowadays people can get information regarding sexual health. Very easy to approach. Any teenager can go on internet and whatever his mind, whatever the things come in his mind, he can Google it and find out the things. So it is easy access to diverse sexual health resources and support group. So this is very good advantage. Second is LGBTQ plus inclusivity. So exposure to different sexual orientation and gender identities reduces stigma and fosters acceptance. So positive influence is lot of information, but anything in excess is always bad. So whenever a lot of information is there, a lot of misinformation or myths are there. So, for example, many people go and Google the things, and all information present on internet is not scientific or genuine. If I talk about few things like masturbation. So a lot of things are there about the masturbation. Few people think that masturbation is not appropriate. Internet information. So some people get confused with so much information. And second is an unrealistic expectation. Pornography and idealized representation of sex can distort understanding. So here psychiatrist's role is correcting misinformation and helping individuals develop a realistic understanding of the sexual health and relationship. So information, lot of information is coming. We just need to put it a filter. We need to make people to understand, to see in that way perspective. Means for teenagers or any adult coming to us, we need to tell them, if you want to assess any information, go for a genuine sites, go for a genuine paper and learn there. Second, social media and sexual identity information. So opportunities means whatever advantages here, safe places like platforms where individual can explore and express sexual identity without immediate real world judgment. लोग डरते नहीं है, बोलते जब इंटरनेट सर्च करते हैं लोग ना अकेले बैठ के करते हैं, तो फियर ऑफ जजमेंट नहीं रहता है. बहुत बार फियर ऑफ जजमेंट रहता है, इसीलिए लोग एक्सप्रेस नहीं करते. लेकिन यहाँ पर फियर ऑफ जजमेंट नहीं है, तो पीपल कैन गेट इंफॉर्मेशन फ्रॉम द इंटरनेट. Second, definitely social media and sexual identity information for community support LGBTQ communities, where communities thrive online, reducing isolation or marginalized individuals. So I know practicing psychiatrists, many LGBTQ plus people come, and I understand one that there is one thing called as a coming out about their own orientation. So many times I felt that many of the patients, many of the people who are LGBTQ plus come out online first, rather than coming out to the parents, friends or a trusted one. So this is something they feel comfortable. So community support is the potential risk here. Pressure to define identity like social media culture may push individuals, especially adolescents, to label themselves prematurely or in inauthentic ways. So sometimes rapid exposure to diverse identities can overwhelm some, leading to internal conflict or stress. Here the psychiatrist's role is encourage healthy exploration and emphasize that identity is fluid and personal. Supporting individuals is a non-pressured and self-affirming process. In my practice, I sometimes find that when some adolescent is coming and he's confused about his own orientation. Sometimes he's not sure that his orientation is a straight, or his orientation is a homosexual, or he is a bisexual. So they usually come for one session, second session, but they are not convinced what exactly the orientation is there. So I asked them, where you got all the information? So they say that I have read all these things and I feel that this is something. So sometimes I tell them, wait for few days, you will get more clear ideas about your own orientations, so don't rush. So sometimes they get confused with excessive information about their own orientation. Yes, pornography and its psychological impact. So in instant access to explicit content is shaping sexual behavior and attitudes, especially in younger audience. Psychiatric concerns, pornography addiction, excessive consumption may lead to compulsive behavior, desensitization and reduced ability from healthy relationship, and unrealistic expectations like exposure to exaggerated sexual content can distort perception of intimacy and body image. Pornography addiction is like any other addictions. Any other addiction में क्या होता है? तो usually dopamine. It's all about the dopamine reward circuit, or you can say a dopamine spikes everyone want. So जब dopamine spikes लगता है, तो dopamine जब spike जाता है तो ऊपर से नीचे भी आता है. नीचे आने के बाद भी वो low mood feeling जो रहता है baseline का, उसके वजह से वो repeated वो dopamine spike की इच्छा होती है. So pornography addiction is also like that. So repeated watching of the pornography, The most important thing कि for pornography that person कौन से एज में इंट्रोड्यूस हो रहा है. अगर उसका एज बहुत इनिशियल रहेगा, प्री एडोलेसेंट रहेगा, 13, 14, 15, 16, तो उसका इम्पैक्ट टोटली अलग रहता है, क्योंकि वहाँ पर थॉट फॉर्मेशंस पूरी तरह से नहीं हुए रहते. we usually say that prefrontal cortex is not completely functionally developed there to understand, to make a judgments properly, to take care of their impulse controls. ये सब रहता है. So pornography is like an addiction. Then its most important thing is lot of उसके misconceptions हो जाते हैं. So that is how the psychiatric concern. And what we usually do in pornography addiction is a CBT to address compulsive behaviors and help clients differentiate between entertainment and real life intimacy. I just want to share a recent patient's experience about a pornographer. So basically a couple, when they were intimated and when they had a penetrative sex, when the male partner is coming out, he started screaming. And that female partner frightened a lot. So she asked him, why you are screaming so much? Why you are screaming so much? So he said that this is something a normality. She said that, hey, ये तो normality नहीं. Then he said that I can show you everything on the porn. लोग screaming करते हैं, shouting करते हैं. Basically, being a sexual medicine practitioner and psychiatrist, the sexual relationship, intimacy, orgasm, these are very, you can say, a very sensitive things. People moon, M-O-A-N, mooning is different, and screaming and shouting is different. But misinformation, or you can say learning, wrong learning, that shouting and screaming improves the sexual pleasure, उसके वजह से होता है, लेकिन उसका impact second partner पे भी होता है. She got frightened, now she feels very uncomfortable when he screams. So this is something, these are distortions we are supposed to correct. Then cyberbullying, sexual exploitation, and digital consent. Cyberbullying and revenge porn, digital sexual harassment such as sextortions or unsolicited explicit content is growing concern. Sharing explicit material without consent can lead to severe psychological trauma. इस तरीके के पेशेंट्स भी काफ़ी बार साइकेट्रिस्ट का कंसल्टेशन लेता है फॉर PTSD, acute anxiety, or you can say PTSD, post traumatic stress disorder. Victims of the cyber exploitation often experiences long-term emotional damage. Trauma can deeply affect a person's ability to trust future partners or maintain relationships. So here, trauma-informed care as well as empowerment and legal support should be provided. Sexting and digital intimacy. It's like sexting is increasingly common as a part of modern relationship, fostering intimacy at a distance. Talking about the sex on phone, that is sexting. So help clients here navigate the complexities of the digital intimacy, and the privacy is very important. Body image and sexual self-esteem. I want to talk about this slide here as a psychiatrist because influence of the social media is a platform like Instagram, TikTok and other promote idealized body types, often hypersexualized. इसका इम्पैक्ट निगेटिवली वो पर्सन पे ऐसा होता है कि जो बॉडी सेल्फ इमेज रहता है काफी निगेटिव होता है. And if that person get negative body self image, he's going to develop anxiety or he's going to develop a depression, low self esteem. ये FOMOs बोलते हैं ना, इस तरीके से भी चीजें होती है, and that is somewhere we need to help that nothing there is ideal. It's all about a comfortable with yourself. So cognitive restructuring help clients to challenge unrealistic standards and promote body acceptance as they are. And mindfulness-based therapy develop a healthier relationship, their body and sexuality. So virtual reality and exploration. So I just go for a final thoughts here. So lot of things are coming from internet. The only thing we should keep in mind that what exactly people are perceiving. I say that the education has to be filtered. The second thing is the expression. The expression has to be controlled, and the exploration, it has to be appropriate. And most important things, engagements, it has to be legal. So internet is giving a lot of things to us, but most important, navigate these opportunities and challenges by fostering healthy sexual behavior, addressing trauma, and promoting self-acceptance in the digital age. Thank you very much.